Mental and physical health are equally important components of overall health. For example, depression increases the risk for many types of physical health problems, particularly long-lasting conditions like diabetes, heart disease, and stroke. Mental health is a big issue and should be treated as such. Maybe because mental health illnesses are simply not as concrete as physical illnesses, they are often not taken as seriously. Contrary to this popular belief, mental health or mental illnesses are actual diseases that must be treated as seriously as physical disease, such as cancer or heart disease and such like. There are very serious implications of ignoring mental illness or mental health issues, because worsening mental health problems, if you do not get better, it can get to, if it's not picked up on time and dealt with, it can lead to all sorts, including the word S, which is deleting, I don't want to say that here, but some people deleting themselves. So we have to take this very, very serious. And we also have to know the type of words we use around people who have mental illness, because some of the things people say or do around them makes them not to be open, as I said in my last video, why people hide from disclosing their mental health symptoms. There are things we should not be saying. For example, saying that somebody, oh, look at that, they're acting like they're acting nuts, like nuts. Right? That's a slang they use here in the UK. I don't know other parts of the country whether they use that. Oh, she or he is acting nuts. Or they say, oh, he's bipolar. Various things. We have to avoid certain words that label others, like crazy, nuts, not normal, you're psycho, you're schizo, you're loony. There are various things that people say. If a person is struggling, they might fear being judged by others. And using these kinds of labels or names can make their their feelings to be worse. Don't speculate about whether somebody has a mental health disorder and what their diagnosis may be. You are not a psychiatrist. So stop using certain words, as I said before, such as crazy, nuts, you're psycho. But use words that show acceptance, because the person is an individual. And as I said, this thing can happen to anybody. Use non-stigmatizing language, so we can see people as people first and their disorders as second. For example, instead of saying she's depressed, say she has depression. And instead of saying he's bipolar, say he has bipolar disorder. If actually you have to say that, really. And instead of saying she committed suicide, just say she passed away by this. By making these small changes, we are showing acceptance. We are accepting that person as an individual. So stop saying she's depressed, he's bipolar, she committed the word S. Stop saying things like that. Try not to minimize what people are going through by being dismissive, because you're not in their shoes, you're not in their head, you don't know what they're going through. So don't just dismiss it. It's not easy for them, And by telling them it could be worse, or saying, oh, just brush it off, we are being unhelpful. It's not going to help that person. And often it's hurtful. We must practice empathy by being mindful of what others could be experiencing. We don't have to minimize what people are going through because you're not in their head, you're not in their mind. If you don't have anything nice to say, don't say anything. Whether or not we are personally affected by a mental health disorder, we can be champions and advocates for a better understanding of people who have them by challenging harmful language and beliefs when we hear them. Yes, when you hear certain languages or hear people saying things, the people that they're talking to may not be able to defend themselves because they're already maybe withdrawn. Challenge it. Tell the person, stop it. Don't speak to this about this person or so and so like that. Speak for them. Support them. It will help a lot. So these are just some of the do's and don'ts and some of the things we shouldn't be doing around people, so that this will make people to be open to come out and share what is going on in their lives and what is happening to them, so they can get help quick. I will conclude by saying that we use the right choice of words. When people around you have signs of mental health, reassure them. Show them that you care about them and that you are there for them. Use I statements and not you. For example, try saying, I am worried about you, or I would like you to consider talking to a counselor. Avoid statements like, you are, or you need to, or you should. Use, I think it would be nice for you to. Always use I. Avoid you. You are, you should, you need to. Because once you start using those kind of words, the person now starts thinking that you're seeing them as somebody who is not right, who is different from every other person. And also stop saying, oh yeah, I felt that way. I felt that way before. I know how you're feeling. I felt that way last year when so and so happened to me. No. You may feel that way or similar way, but don't say that you know how they're feeling, because you don't. Everyone's feeling is, peculiar to them. So avoid these words. That's where I want to conclude this one. Thank you so much for listening. I'm sure we have got one or two things. Please let us be open about mental health, discussing it, because that will help a lot of people. Thank you so much for listening. I'll see you again in my next one. We're still on mental health. So I'll see you soon. Goodbye and God bless.